Mary asked me to come and speak to you tonight about advocacy. And I think I had some grandiose title like How Advocacy Can Change the World. And I really do believe that. And I have a long history. In fact, I always say I really consider myself really an organizer and a connector. It's kind of at the heart of who I am. I was actually trained in organizing back a long time ago. And it's really an approach that I take to a lot of my work, and it translates well. So advocacy is very important to me. And when I took the job with NAMI, Iowa, a little over 2 years ago, I said this is going to be a focus of mine because this is an important thing for NAMI to be doing. I actually came from the American Cancer Society, where I spent 7 years as the Iowa Director of Government Relations. And I had other advocacy roles. I've been communications, fund development, government relations, and executive director for different nonprofits. And I feel like all those things have prepared me for my role at NAMI because I have to call on all those skills for what I do with NAMI Iowa. But advocacy is very near and dear to my heart. And I've been really excited to see the growth and what we've been able to do in the last 2 years with NAMI. We've had some terrific successes. But I thought I would just start out tonight by telling you about I call it the tale of two bills. When I was with the Cancer Society, my very first day on the job, and my boss was in Des Moines from the Twin Cities, which is where she was, we had to run up to the Capitol for a subcommittee meeting on a Smoke-Free Air Act. And I will never forget her telling me, this is never going anywhere. It's never going anywhere. It's too comprehensive. We've never had local controls in Iowa. It's just never going to go any. But, we have to go through the motions. I'm like, okay. I didn't know any better. And it was the second year of complete Democratic control of the state. Chet Culver was the governor, and the Democrats controlled both the House and the Senate. The first session, they had passed a big increase in the cigarette tax. And this was kind of the next thing on the agenda of the Advocates, Tobacco Coalition. But no state had ever passed a comprehensive smoke-free bill without first having local restrictions in place or having some other statewide restrictions. They'd never gone from having nothing to having a comprehensive bill like this. Has never happened. So I was brand new. Our lobbying team was brand new. And we came into this tobacco coalition. This was 10 years ago, 2008. And sometimes it's good having people who don't know any better, because we were kept being told, never going to happen, never going to happen, never going to happen. And we're like, well, maybe it will. And we just kept plowing ahead. And it just kept passing through hurdles. It passed first through the House by 1 vote. Then it went to the Senate. It passed by more votes in the Senate, and then the Senate actually passed a stricter bill. And that included casinos, which, as you know, that's not how it ended up. Then it went back to the House. The House refused to concur with the Senate version, so it went to conference committee. And the tobacco industry and the restaurant and bar people, which were our opponents on this bill, were pretty convinced they had it tied up in conference committee. It was never going to come out. That was the word. It's dead. It's dead in conference. Well, we had a very effective coalition, and that's one of the things I'm going to talk about, the ingredients for passing successful, for getting things changed. We had a very successful, a very powerful coalition that wasn't just the advocates like, the Cancer Society and the Heart Association and the Lung Association and the Medical Society and, all the people who care about health. We also had the business community, because people like the leaders of the principal group and Meredith Corporation saw this as a recruitment tool. They're trying to recruit people from around the country, even around the world. Pioneer is another one, to come work in Des Moines. They saw we need to have a non-smoking environment. We don't want our people coming in and experiencing cigarette smoke in a restaurant. So they got on board and started helping us. And very quietly were working the people on the conference committee. And the coalition met twice a week, and we were constantly divvying up who's talking to who says what, constituents. You get their neighbor, the person who cuts their hair, the person who gave the most money to their campaign, we're very strategic in how we were, plus just all the grassroots phone calls and letters and everything coming to them. Well, we got the bill out of conference committee, much to the surprise and chagrin of the tobacco lobby and the Restaurant and Bar Association. And then the conference committee report, which was a compromise, of course. It did not include casinos, but we were okay with that because it included everything else. Ended up passing both the House and the Senate by one vote. And it was very dramatic. And I told this story to a group, to the Cancer Society State Board the next month in Iowa City, actually. And I told it in very dramatic detail because I was just so proud of how it all happened. But in the House, the vote came up and it was tied. And Kevin McCarthy, who was the majority leader, went around and had his arm around members who still hadn't voted, whispering in their ear. And so he got one more Democratic vote to put it over the top. It was a bipartisan vote, but the only Republicans who voted for it were the ones who were not going to be running for re-election. Then it went over to the Senate. Mike Gronstel made a very emotional speech imploring people to vote for the bill. He lost both of his parents to lung cancer. And Mike Gronstel didn't get emotional. He was like steel. But that's the first and last time I ever saw him cry on the floor of the Senate, was when he was giving remarks on this bill. And he said, if you care about the future and the health of Iowa, you better be voting for this bill. And Mary Lundby, some of you might know her or remember her. She was a Republican legislator from Marion. She voted yes. And they were at 49, or they were at 50. One more vote. 5 votes left. Everybody's watching the board. Gronstel's going around, working the room. We're all watching and waiting. The last Democrat to vote, because we were pretty sure that none of the other Republicans were going to vote for that conference committee report, was Wally Horn. And some of you might know Wally. He's retiring. He retired this year after being the longest serving state senator in the history of Iowa, from a blue-collar neighborhood in Cedar Rapids where a lot of people opposed this bill. And he had voted no twice on the bill. And he was the last Democrat to vote. And we're literally holding our breath, waiting to see what's going to happen. And Wally Horn looks at everybody, looks around, and presses the button, yes. And the bill passes. And the place just erupts. cheering, crying, clapping. It was really incredible. And we were in the lounge, the Senate lounge, and we waited for people to come out, and Senator Horn came out, and I said, "Thank you so much." And he said, "I couldn't be on the wrong side of history." He said it was weighing on me. I'm going to be retiring someday soon, and what am I going to tell my kids and my grandkids? How I voted on this bill. So, he said, and I heard from my constituents, people who are affected by this disease, who are lifelong smokers, who told me their stories, and that's what I was remembering when I stood there. So the bill passed by one vote in each chamber, went to the governor, was signed, and went into law. And that's changed how we live in Iowa, right? I'm sure you all remember what life was like before, smoking or non. And it's saving lives. We have reduced cancer rates, reduced cancer death rates. Regardless of your opinion on smoking, that's an empirical fact. And the only reason I'm telling this story is because that's the first bill, and the second bill is the complex needs that passed this last session. And they have some things in common, okay? They're both really important policy bills. They both affect the lives of tens of thousands of Iowans. They both had strong coalitions behind them. Different coalitions, but strong coalitions. They both had an unlikely, as we call it, unlikely bedfellow, right? The saying about politics makes unlikely bedfellows. Unlikely partners. And in the case of the smoke-free law, it was the big business they were lobbying because they saw it as a business climate issue. In the case of complex needs, it was the county sheriffs. They were up there every time we needed them. They were up there in their uniforms talking to legislators, telling them, you have to pass this bill. And in both cases, they were instrumental in getting those bills through. Because we advocates can be up there till the cows come home saying, we need this, it's the best thing for Iowa, but they expect that from us. They expect that from the Cancer Society or the Lung Association or NAMI or the Hospital Association or Behavioral Health Association, but they didn't expect it from Meredith Corporation and Principal Financial Group and the county sheriffs. And in both cases, that unlikely support is what helped push these bills over. The other thing that they have in common is that they had strong legislative champions and they had support from the governor's office. And if you don't have both those things, it's highly unlikely you're going to get your issue through. You really have to have both things because the governor not supporting it would have been enough to kill it at any point. But she actually was very supportive and helped us every step along the way. And with the Smoke-Free Air Act, Governor Culver helped us. Now, how they were different is with the Smoke-Free Air Act, I always say it took every single person doing every single thing. You know that saying about how a snowflake, the last snowflake lands on the branch and the branch snaps, right? It's the weight of that one last snowflake that makes the difference. That's true too, and if maybe you read the book The Tipping Point, same idea. You have to have a certain weight to get something through. But with the Smoke-Free Air Act, it literally was the last snowflake that got that bill through, and just barely. Highly emotional and controversial. The complex needs bill was also emotional. It really wasn't controversial. And as most of you know, it passed unanimously. much to the shock of most of us who were working on it. I will never forget, Jerry Foxhoven told me in January, in the first week of legislative session, and if those of you who know Jerry, I know he has his detractors, but he is an infectiously enthusiastic person. And he said, "We're going to get this passed unanimously." I said, "What are you smoking?" "There's no way this is going to pass unanimously." "Oh, I think it can. I think it can, Peg." "Okay, Jerry." Well, I was in Florida on vacation the day it passed the Senate unanimously, and guess who I got a phone call from? My cell phone rings. I'm literally sitting on the beach. I'm like, this is Jerry Foxhoven. Yes, he was sitting in the Senate gallery watching the debate, and he called me to tell me that the bill just passed unanimously. Like, okay, you win. I'm glad you won. You called it. So it was a surprise, but what happened was that enough legislators heard from enough of you that they knew they had to do something. They knew politically they had to do something. And then they got this report handed to them by this group that had, all the different groups that cared about it, the hospitals, the providers, the doctors, the sheriffs, everybody. And we all agreed on a course of action. And we handed it to them. And they said, maybe we should just do what they say. Maybe we should just listen to this group of people. And then the proof really was, though, that we were all up there week after week after week, pounding away at them, making sure it got done. And all of you were part of that, too. And they knew they had to do something, so they might as well do this because all these people agreed on it. And in the end, I said, it's not that every single legislator loved that bill. It's not that they even all understood the bill, honestly. It's that they got the message that they could not vote against it. So it passed unanimously. And I'll tell you, were any of you there at the bill signing ceremony? You guys were. It was emotional, wasn't it? It was probably, I've been to a lot of bill signings. I've been involved with the legislature for 35 years. That is by far the most emotional bill signing I've ever been to. I mean, people were crying. Now, it wasn't just the complex needs law, the suicide prevention bill was signed that day too. And there were a lot of parents who were very involved with that. But it was an emotional day. And people understood, the people were ring the gallery across the second floor in the rotunda. And as the governor was speaking and as she was signing, I get goosebumps thinking about it. It was absolutely quiet. You could hear a pin drop in the rotunda of the Capitol. That never happens. Never. So it was a momentous day. And for all the kind of pushback about how it's not funded and it doesn't maybe do enough, and, it was a very significant achievement. And we should all be very proud that we were all part of making that happen. Now, do we have to work to make sure it gets implemented correctly? Yes. Do we have to work to make sure it gets funded and that the MCOs pay for the things they're supposed to pay for under Medicaid? Yes. Do we have to be ever vigilant to make sure that the regions are doing their jobs and doing the things that the citizens in their regions want to see come out of that, and that they all are talking to each other to make sure these access centers are placed strategically around the state, and that everybody has access, and they're working, and that every step of the way these services roll out the way they're supposed to. Yes. That's all of our jobs. Well, that's the job of the advocate, is we're going to make sure this is law now, people. It's law. Takes effect 11 days from today. And then it's in the law. So if it isn't done, it's our job to make a big ruckus about it and make sure we understand why and make sure it's fixed, because it's the law. And that's the power of advocacy. We don't just complain and say we're the worst in this, we're the worst in that. It's terrible, it's terrible, it's terrible. We have been part of an effort to change it for the better. It's going to be better a year from now. It's going to be much better 2 years from now. And it's going to be that much more better 3 years from now. Because we're going to work to make sure that all these things happen the way they're supposed to. But it all started because we were able to come together and make enough noise to get them to act. And that's the way the system's supposed to work. It often doesn't, but in this case it did. So that's my story about the tale of two bills. Now I want to talk a little bit about, I brought some materials and how NAMI Iowa can help all of you be better advocates, okay? Because that's why we're here. I brought a story from the Des Moines Register that Tony Lays wrote. We had a big rally at the Capitol. It was actually the week after our Day on the Hill with the Hospital Association to push to get this going through. Article about that and the difference that advocates were making. This is our legislative wrap-up for those of you who haven't seen it. Talks about complex needs and suicide prevention. And another significant piece of legislation that we got passed with the Hospital Association is the telehealth bill. And that requires that commercial insurers reimburse for telehealth services on the same basis as they would for in-person, which is a big access issue. So we have that. We also, by the way, got all of our appropriations that we asked for. Then I've got some resources for you as advocates, okay? How many of you are signed up for our advocacy list? Do you get the emails? Okay. If you're not, you better sign up. Right here. Yellow sheets right there. We have over 500 people now on our statewide advocacy list. I do a weekly update during the legislative session. I do a monthly update when they're not in session. And we always have a call to action every week. There's stuff for people to do. And we provide phone numbers, emails, bill numbers, everything you need to take action. Now, the really exciting news about that is that we are one of 4 pilot states in the country that is adopting the national advocacy platform called Quorum, which when we get everybody entered into this, we're going to need your addresses, so just be prepared. You're going to have to share your address with us. But the reason that's important is because we're going to know which legislative district you're all in. So when we need to get phone calls to Linda Upmeyer or to Mary Wolf or whoever it is, we can look and we will know exactly which advocates do we have in that legislative district, and we can turn them out to make sure that they get the message to those legislators specifically. We can craft messages. We can do, we can forward phone calls directly to the House or Senate lounges from people. We can, with legislative forums, you know how we just sent out that whole list every week? Oh, now we can customize it. So we can tell you have a legislative forum this weekend, and it's at this place at this time, go. And then we can even say, tell us if you went and give us feedback. What happened? Did you talk to someone? What'd they say? Because that kind of information is invaluable in helping us be effective advocates. So we're in the process of making that transition, and we will, of course, there's going to be an election in November. I think some of you have heard that there's an election. And we'll be getting all that new legislator information into our system. And come the second week in January, we'll be ready to go with our new quorum system and with all of our advocates in that system. So if you're not already on the list, be sure to sign up. We have an advocacy toolkit, which some of you may have seen. We have it at our Day on the Hill. I brought extra copies. We do have an advocacy tab on our website, which has a lot of great resources. This is on there. So there's no copyright. If you want to make 100 copies and, feel free, use it. One of our interns did this. It's great stuff. And we have NAMI Smarts, which is a great training for people interested in learning how to become better advocates. And we have some trainers, and they're available to come out and do a NAMI Smarts, and it explains all about it in this little brochure. Another thing that we did, and this is the kind of thing we want to do more at NAMI Iowa. Oh, I should say, we also have a professional lobbying team. And if you came to Day on the Hill, you've met them. It's PolicyWorks. John Cacciatore is our chief lobbyist. He was the chief of staff to Governor Tom Vilsack. He's been around the legislature and government for a long time, and he's very good at what he does. And then we have Renee Schulte, who a lot of you have met. She's a former Republican legislator from Marion. She now lives in Des Moines. She was one of the architects of the mental health reorganization, and she's a licensed clinical social worker. She used to work for Four Oaks, so she knows her stuff, and she's been invaluable. Plus, she used to room with Linda Upmeyer. That's come in handy. Maybe we should cut that part out. Oh. No, it's fine. Everybody knows that. Renee has been our expert on the Iowa mental health system and on the mental health tax levy and on a bunch of stuff that the rest of us didn't know enough about. She's an awesome resource. And then we also have Christopher Rance, who is the former Speaker of the Iowa House from Sioux City. And I'll tell you, that's a really incredible team. And they have made all the difference in helping us to advance our agenda. But they don't come cheap, okay? It takes a fair chunk of money to hire a team like that. So between our lobbying team and our Day on the Hill and doing all the updates and all this other stuff that we do, we spend about $50,000 a year on our advocacy efforts. But that's a priority for me, and so we raise the money to fund it, because you're not going to get a grant to do advocacy. So we do Beautiful Minds, and we take a part of our walk proceeds, and yeah. But I really believe that it's going to pay off for us in the long run, because in just 2 years, we've really built our profile as being a very strong part of the, we really are the thought leader for mental health in Iowa. And I'm really proud of that. So connected to that, and I think part of the reason for that is I decided last summer that I wanted to meet with all the gubernatorial candidates and talk to them about mental health. And then get them to answer questions. And I shared this idea with John and Renee and Christopher, and they said, okay, good luck with that. You mean you actually want to meet in person with all of them? Yeah, okay, right. High degree of skepticism. But I'm very happy and proud to say I actually did meet in person with all of the candidates, except Governor Reynolds, who I did end up getting to meet with in person in February, but not during that time period. I met with all of them. I answered questions. They all gave me an hour to talk to them about the mental health system, and a lot of them were woefully ignorant. They had very elemental questions. And I would, that was like Vegas, right? What was said in those interviews stays in those interviews. But I think they appreciated the opportunity to ask questions that might be embarrassing to ask in a more public, open setting and get answers. Then I gave them a questionnaire and I said, we want this back by October 31st. And I started meeting with candidates in July. So some of them had a long time to fill out that questionnaire. And then the very last candidate I met with was mid-October, so it took a while to get through all of them. But I met with 11 candidates. This is the answers. These are the answers to all the questions that we posed. It's by question. We have it on our website in this format, and we also have it broken out by candidate, if you're curious. Of course, the primary is over now, but this was more relevant before the primary. And we put this out in November. We unveiled it at our annual conference in Des Moines. We promoted it with weekly paid Facebook ads. We had almost 50,000 views of we had 9 weeks of paid Facebook ads to promote this. I did tons of interviews about it. The Register decided to do a gubernatorial forum, which I know the Carpenters attended, at Des Moines University in December. I met with them to help them plan that, and Kathy Obradovich used 3 of my questions in that forum. So I really feel like NAMI Iowa put mental health on the map for the candidates. And you'll remember this, Carpenters, that pathetic video that the governor sent, right? She was the only candidate to not attend. And she was given some political advice to not go. So she didn't. She sent a video instead, and it was horrible. And everyone agreed it was horrible. I mean, in every respect. It was technically horrible. It was content-wise horrible. It was just horrible. And the backlash to that, Renee Schulte was sitting right behind me in the thing, and she was like, that was her reaction. My Republican friends were texting me, watching it live stream, saying, what is this? What did she do? The reaction to that was so bad and so strong and so swift that just 5 weeks later at her Condition of the State, she highlighted the need to address mental health. And she said, we're going to pass a bill. We're going to do something. Because of the reaction to her lack of attendance and pathetic response to that forum. And she really was very supportive of complex needs. And now she's going to appoint this Children's Mental Health Board, and it's supposed to happen this week yet still, so stay tuned for that. But this, I think, really changed the dialogue, and it made the candidates pay attention. And I don't know if you guys were listening, but when I watched the debates, mental health was brought up at every single one. They talked about it. They had specific answers. I didn't always agree with their solutions, but at least they were talking about it, right? Which was way more than we've ever seen before from candidates. So I think we've had an incredibly successful year of advocacy in Iowa. I'm excited to see about now the discussion, I believe, will continue in the gubernatorial race. Because if you're paying attention to the ads, Fred Hubble had a whole direct mail piece just about mental health. He did a series of town hall meetings just about mental health. The governor is touting it she talked about it in her speech on election night. It's in her ads. So it's interesting. It's one of the few issues that the two candidates seem to agree on, which is awesome.
Yes.
But we have to keep holding their feet to the fire and keeping them accountable. So if you go to a candidate forum, make sure to try to ask a specific question of, say in your first 100 days, what are you going to do specifically to build on the successes and improve our mental health system? We can supply you with some other ideas for questions, but I believe it will continue to be a major issue in the gubernatorial race and in legislative races. And I think that the next thing on the horizon will be children's mental health system. You're going to see these recommendations come out. From this new Children's Mental Health Board. It has to be to the governor by November 15th. And legislators are primed to address this next. So I think we're hoping it's going to be just like the Complex Needs Bill. We're going to see a set of specific recommendations, and we hope the legislature will adopt them, and we can move forward. And I'm sure there will be follow-up. There's a work group that DHS has formed around the commitment law. There's one around tertiary hospital care. There's going to be some workforce stuff going on. There's supposed to be a legislative interim committee focused on long-term financing for the mental health system, which we're pushing to get appointed. So, we'll keep you apprised of all that when you sign up to get our e-newsletter. And lots of opportunities to meet. I really also encourage you to, between now and the election, go to legislative coffees, go to events, talk to your incumbents and your challengers about this issue, and ask them what are they going to do about it. And don't let them off by saying, "Oh, well, we passed that bill." No, I mean they did, and that's great. But there's still things that need to happen. So I would be happy to take questions. Mary, you think? Okay.
Okay, so we have a question. Okay, hit him first and then, okay.
What would you say about the fact that Iowa still ranks so low in its mental health provision?
Well, we are 50th in the nation in the number of state inpatient beds. Mm-hmm. We are still low, I think maybe 45th, 46th in number of prescribers, number of psychiatrists. You can't. I always say we got to this situation because of a lot of decisions made over a lot of years brought us to this place. And you can't turn that around overnight. So I think we're making great strides. We also got funding for the residency programs, for 2 residency programs in Des Moines. It's Broadlawns, Unity Point, and Mercy. So between the 2 of them, they are going to produce 8 psychiatrists who are strongly encouraged to stay, 8 psychiatrists a year for 3 years who are strongly encouraged to stay in Iowa. We have this collaboration with Des Moines University to try to better train family doctors in psychiatric care. We have 175 beds, new beds, well, 75 for sure in Bettendorf that will be coming online next year, strategic behavioral health. If the Mercy proposal is passed, there'll be 100 new beds in Clive. They don't deserve it, but they'll get it. Kind of inside joke for our table. That will be coming online and projected to be in the spring of 2020. I think so, and some other smaller inpatient units have opened too. Broadlawns increased their inpatient unit by 14 beds. So that situation, the number of overall beds has improved and will continue to improve. And when all these beds comes online, we will be near the middle. So that will be an improvement. But what I've come to understand is it's not about the beds so much. Rick Schultz at DHS likes to say, I've never seen a bed provide any treatment to anybody. And what he's saying is that, a bed, of course, doesn't do that. It's all and simply putting someone in a bed in a hospital, it isn't going to do anything. So a lot of our hospitals are ill-equipped to handle people with serious mental illness, and certainly not people who are in crisis or who have multiple problems or with complex needs. So it's not just about the beds or the number of beds. It's making sure that we have the right services for the people who need them at the time they need them. And that's the goal of this expansion across the continuum, for access centers for people in crisis, the Irish residential, intensive residential beds for people who need longer term, the doubling of ACT teams, which is huge, making crisis services mandatory in every county. I mean, this is all, and then the establishment of tertiary care hospitals, psychiatric hospital beds. That runs along the continuum so that someone, just by having crisis facilities, once they're out of crisis, then what happens? And that has been a problem. We have people who are stuck in hospital beds who have nowhere to go. So we have to develop the whole continuum, and we have to keep doing it until every single person has the help they need when they need it.
So first, my comment is there was another component of the complex needs bill that you didn't mention, and that was the Des Moines Register poll that they did.
You're right.
That had a tremendous impact on the legislators. When we were talking to the legislators, I would always bring that up and say, 70+% of the people in the state want this to be done. And they had no response to that except to say, I hear you. And so that's really important. So
Yeah, it
having that relationship with news outlets, critical. One other just simple comment, those beds and having an open bed saves people's lives. Even if they're not getting any treatment, if they're thinking of suicide or they're doing something rash, having a bed to put them in does do some good.
We should have had you in Clive last week.
Yeah, well, I wish I had been there. The other interesting thing, you just gave us these numbers, and I've been wanting to hear what those bed numbers are. So 175 hospital beds still keeps us last as far as publicly state-run beds.
And that's not going to change, Scott.
Well, I think it should.
Yeah, but it won't. So, I shouldn't say that. Under the current leadership,
I understand.
it will not change. And I'm not sure even if, honestly, if Fred Hubble were elected, it's going to change because...
That's my next...
Okay.
That's my question.
Okay.
Is Fred's plan, if you read it carefully, is to have somewhere between 50 and 75 beds, and he's been on that number since the beginning. And no matter how many times I ask him to talk about something other than that, which now we've got 175 beds. So what's the point of having that discussion of 50 to 75 when those will be online by the time he becomes governor?
I thought that was about subacute, those numbers.
No,
but I might be wrong.
those are acute care beds, as he calls them, high intensity beds,
Yeah.
which I'm not exactly sure what that means.
Well, first of all, we are going to be meeting with the campaign to kind of go over some of that stuff and refine some of that.
I would urge that because
Yeah.
there's a lack of understanding of the nuances of this continuum of care, that and it kind of makes it difficult for people to it's not something you can do on the stump. You can't just say, oh yeah, well I want to tweak this and I want to tweak that, and people just go, oh my God,
Right.
you know, they're asleep. But that's really important that they know what's important. I'll shut up.
I agree with you. I agree with you. But let me assure you, he's come a long way in a year. So, you know, it's steps. And honestly, so has Kim Reynolds. So, and I have to say that I have to give her credit. You know, she has an open door. She's met with us. She's listened to us. When we met with her, she had the complex needs work group report in front of her, highlighted with notes. I mean, she is engaged, and she has a pretty good understanding of the issue. So I give her credit for that, and it's certainly a huge improvement over her predecessor. So I think that it'll be interesting to see how this progresses in the campaign, because on the surface of it, they agree, you know, like, we like this law, more needs to be done, blah, 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 you know, so, but I agree with you that there needs to be more education, and I also want to engage them more on the kids stuff to help them understand, you know. When we met with the governor, she just asked me, she said, why haven't we been able to make progress with the kid, having a children's system? And I said, well,
Have you read those work group reports? Yeah. They are not very clear. And,
yes.
And they're not something that you can make a bill out of, because
No.
they're just a hodgepodge of things and topics. And I tried to convey that to Jerry Foxhoven when he was here last Monday, was that we need to get this to be something substantial that you can get your mind around.
Well, that's why the complex needs work group worked, because we had 5 recommendations, and they were concrete, and they had specifics, and they were SMART goals. And, you know, and legislators like that. They're, you know, so I think part of it is that when you look at the makeup of that children's mental health and well-being work group, it's first of all, dominated by bureaucrats from all the different state departments, who all have their own little turf, you know, they're to protect and work on. And almost automatically protect the status quo and don't want to move forward, certainly not at a very fast pace. And then you have providers who, in the children's system, are incentivized to not collaborate, but in fact they compete with each other. So they all have different definitions, they all have different ways of doing things, and they're protecting their turf, because they all have geographic turf where they serve, their service areas. And then you have the parents, Tammy and Renee, who, you know, try their best, but are outgunned, and I said the same thing to Tammy. I said, you can't have a vision statement to the legislature. You can't say things like, we envision blah, blah, blah. You know, you have to give them specific action statements, and then you have to, this is what we did with the work group, you have to hound them every step of the way to make sure a bill gets written the way you want it to be. You can't just hand over a vision statement and expect them to create the legislation. That doesn't work. So I said all that to the governor, and she said, yeah, that makes sense. So that's why she set up this children's board the way she did, and why she said there have to be specific recommendations by this date, and then we're going to take them to the legislature. So that's my hope.
Next question.
I have wondered. I know part of it is educating the public about mental illness because a lot of people don't understand it or they don't want to understand it. But I don't know that the media or anyone talks enough about symptoms. They talk about the percentages of this person having 2% have schizophrenia, 45% have depression. And even when they report somebody who's mentally ill, who's done something, shot somebody or something, they don't. When this baseball player had an aneurysm pitcher, they listed the symptoms of aneurysm on national TV. But they don't seem to want to promote that. I'd like to see NAMI be out there more doing that.
Okay. That's part of certainly about education and awareness. And we try to do that in different ways, you know, but part of the challenge with mental illness is it isn't just one thing, you know, it's a lot of different things. And so, and also, even within an illness, everyone has different symptoms and behaviors. So that makes it a little bit more challenging. But what I learned at that community meeting in Clive last week, for those of you who read the news coverage of that, is we still have a lot of work to do. And I never heard stuff like that up at the legislature. And so either the legislators were smart enough to not say it to me. They might really be thinking it, but they didn't say it. Although I did have a few legislators tell me that this is not the government's responsibility. It should be up to the churches and the families. Yeah. That's really very much in the minority. But I never heard anybody call us crazies or tell us that all people with serious mental illness are violent criminals, which I heard in the city of Clive when we were talking about locating a inpatient facility there. So, you know, I think it's certainly improving. We're getting there. We're making progress. But we just have to keep at it. I also see that I have 3 young adult children, and I think that the millennials are doing a much better job of being open and addressing stigma. They talk about this stuff much more openly than my generation ever did. And certainly my parents' generation, never, So it will over time get better. It will continue to get better, but we just have to keep working at it. Anything else?
So I was at the East Central Region Governance Board meeting about a week ago or so, and there were a couple supervisors from more rural counties that kind of perked up when we mentioned financial losses for providers, and so I just kind of wanted to make that comment that it seems to be the fellow that mentioned it said it was an unintended consequence of, you know, tiered rates and legislation that had passed, and that he would like more information to take to his legislator about it. So,
Are you talking about as a result of Medicaid managed care?
yeah, I think it's the tiered rates for mental health and disability. They're different tiers, but he is someone who I guess I don't agree with a lot of the time in those meetings, but it appealed to him to know the financial loss so that he could actually take it to some of his legislators and say, hey, you know, it's not sustainable. Providers are going to be closing their door, and then we'll have even less resources.
Well, that obviously is a very hot topic in the legislature. There were a lot of bills introduced around, you know, making changes to Medicaid managed care. None of them passed because the majority party opposed any kind of change. Now, what was interesting, I actually met, y'all know that there's going to be a new managed care company in Iowa, too, right? Centene. They're going to start next July 1. And I met with representatives from that company today, coincidentally. They are the largest provider of Medicaid managed care in the nation. They have over 12 million members nationally. And we were talking about this issue, and I kind of joked and said they wanted to know, like, what are my suggestions for how they can, to get into the market and what they should be doing, who they should be talking to, what are the mistakes that the other companies have made that they can avoid. And I said, well, really? You couldn't do much worse. So there's nowhere to go but up. And they, laugh politely. But we talked about the fact that a bill to move all of the LTS population, long-term services, which is predominantly mental health and disability services, although with some physical chronic conditions, from managed care back to the IME, Medicaid, lost by 1 vote in the Senate. It was offered by Senator Pam Yoakum, and she thought she had the votes, and she did have the votes until Jack Whitver went around and changed 2 votes. So, but that just shows you the potency of that issue, that Republicans were ready to break party lines, go across party lines to vote for her amendment because they are seeing and hearing exactly what you talked about. And that, that's a very potent issue. It's one thing when people don't get services. That's just those Medicaid people, But when their local providers are not getting paid, and especially in the disability section, they're going out of business because there's a lot more smaller providers and mom and pop operations, and they have that LTS population, and they have gone out of business. That gets their attention. So that's not going to go away. And but Fred Hubble has said he's not talking about going back to state-run Medicaid. He sees like a hybrid of a version of managed care, but that behavioral health was managed care, right? Magellan. We had Magellan for 22 years in Iowa. They were managed care. So managed care isn't necessarily bad or horrible if it just depends on how it's done. And in Iowa, we turned over way too much, way too fast, without enough safeguards. And with this expectation of a huge amount of savings. And that's what kind of doomed us. That was a long answer. Sorry.
No, I appreciate all of it. Anybody else?
Yes, Peggy. I'm Jen Day.
I know Jen Day.
Yeah, imagine that. As you know, I'm a peer support specialist here at NAMI Johnson County, and I'm wondering how the profession of peer support, using one's own life story to be a support, a role model, and a fellow to those going through their own illness and their own crises, is part of NAMI Iowa's agenda for next year.
That
because
is a
I
great
gotta tell you,
question,
Peggy,
Jen.
Before I had this career, I was starting an application for permanent disability. And this might sound a little inflated, but I think I have a lot to offer. So,
Well, I think we would all agree
this
with
changed
that.
my life, and to be able to help change other people's lives and use what I've learned and what I've been through is powerful. How do you plan to help expand the peer support specialist workforce in Iowa in the next year?
Oh, great question. We were just talking about that this morning because we had a peer support collaborative meeting. And we were just talking about that very issue. And I have some very definite opinions about that. which I have been pushing within the collaborative. And I really want to focus on workforce development. Training and certification, all that, that's not my bag. That's not what we do. But everywhere I go, I talk about peer support. Literally everywhere. And talk about we need to be doing more, we need to be doing more, we need to be doing more. So I really want to focus on that. It's a goal of the Office of Consumer Affairs, the OCA, which we administer for DHS. And I would like to give Heather, I'm gonna put you on the spot a little bit, Heather. I'd like to give you, Heather is a certified peer support specialist. She's been working at Berry Hill, which is a pioneer in the use of peer support. They have it in the emergency room. They use it all over. They've done case studies on it. And Heather started on Monday, but she already has a lot of great ideas that I know we're going to be pursuing. NAMI Iowa /OCA/ Peer Support Collaborative. Heather?
Well, one of the things that we have been doing, this has definitely been a priority of the Office of Consumer Affairs. The advisory committee has gotten together, and over about the last 6 months, we've had quite a bit of communication with Iowa Medicaid Enterprise about, we're kind of taking the tack of showing them the money and showing them where they can save money. So kind of taking the tack of working on changing the billing structure for peer support specialists. So currently, United is willing to do unit billing for 15-minute units. AmeriGroup is kind of, they're waffling. They could do it, but they want to wait for the state to change the code. So
To make them.
Yes, they want the state to make them. So we've taken the tack of working and communicating directly with IME. We have received communication back directly from Director Randall, stating that they are reviewing that code, and they do expect to make a determination on it. We don't have a timeline, but he has explicitly expressed IME's and DHS's support for peer support as a very valuable service for Medicaid clients. So that is one tactic that we've taken. And this is something that's very near and dear to my heart as well, because I started out when the IHHs started their phase 2 programming. So I kind of helped create what that role means for IHH and what that means in the Fort Dodge area. So we have elevated that role of peer support specialist, and with great support from our executive director, Erin McHone, who is fairly high up in Unity Point. He's been a great proponent of using peer support through the IHH in the emergency departments and using that on the forefront of our relationship with emergency services, also using it as patient advocates for physical health appointments as well as behavioral health appointments. And the Berry Hill peer support specialists are currently also involved with their substance abuse services that just started this year. I'm trying to think of the other ways. Oh, yes, and something that I know a concern with the peer support workforce is what happens if the IHHs go away. So we're trying to, again, push for that billing code change, but also push for these, especially community mental health centers that have peer support specialists on staff, to begin that unit billing, like truly to understand the Medicaid billing code. We were just talking
That's
this
a big
morning.
part of the battle.
Yeah,
is
we were
getting them to understand how to bill Medicaid.
Yes. But, thinking of other positions that peer support specialists can take where they're still providing that emotional support of somebody who's been through it. So before I left Berry Hill, for a few months, I have been providing services at the community support program level of care. So the Berry Hill has taken the tack of, through working for a community mental health center, I qualify to be a community support person, even though I don't have a degree in psychology or human services. So they have a very, very high level of respect for the work that we've done through our IHH over the last 4 years. So it's requiring directors to think outside of the box, and that's easier said than done. But just know that we do have partners in this. Aaron is very, very vocal about this, and he's plugged in, and he's with us in that regard. So I think it's going to take a lot of those folks talking to each other as well. So as well as the work that we're doing with the OCA. So.
And it is a big priority for OCA. Also, another development is that the Department of Corrections is starting an apprenticeship program in their prison system for peer support. So they're going to start training people in the prison systems to become peer support specialists. So they can do that just like carpentry or any other skill that they learn. Now, we understand that there are barriers, right? So we're going to have to work on, but there is a specialty called forensic peer support. And in other states, they're doing that really successfully. You know that the state of Pennsylvania employs over 6,000 peer support specialists? Yeah, there are other states that just are way, way ahead of us. And so, they're way ahead of us, so we know what works. There are forensic peer support, there's geriatric peer support, there's all kinds of subspecialties that we could be promoting and working on developing in the state of Iowa. But part of it is, we were talking about this today, is like, I think we need to develop a road show and take it around. And we have Aaron McCone talking about what they've done at Berry Hill, and we have Bob Lincoln talking about what they're doing in his region, and we have somebody else talking about the use of peer support in some other way. 3 different examples, really different, of successful use of peer support. Orchard Place could talk about family peer support. They do a great job of using that. And then how do they pay for it? Which seems to be the big question always. Well, people are using it, people are doing it, and they're getting paid for it. So a lot of it is, a standard pushback to, well, we don't know how to pay for it. There's, like, it sounds good, but we just don't know, like, how to get there. Well, we want to be that conduit. Does that help?
Thank you. Yes.
Just like our clients sometimes need hand-holding, sometimes the providers need hand-holding. So.
Anybody else? Okay. Thank you for coming. Thank you for sharing. Thank you for hearing us.
You bet.
So thank you for all the hard work this year.
You're welcome. Thank you for all you've done.